Dr. Zarr?
Dear Chairman Grasso, Councilmember Allen, and to all the Committee on Education, thank you for holding this important hearing today. So my name is Dr. Robert Zarr. I am a father and a pediatrician who has lived and worked in DC for nearly 14 years. During my day job at Unity Healthcare, our city's single largest healthcare safety net, where 1 in 6 DC residents receives primary care, and where 25,000 children see their doctor for regular visits. My colleagues and I see firsthand the ill effects of poverty. Poverty means different things to different people, but one common thread is the inability to read and to read well. Imagine trying to take your medicine correctly when you can't even read the instructions on the medicine bottle. Imagine trying to arrive on time for your doctor appointment when you can't read the signs in the metro. Imagine trying to eat healthful foods when you can't even read the list of ingredients. This is a daily reality for thousands of DC residents. Recognizing the role of literacy in combating poverty has led my colleagues and me to establish 28 Reach Out and Read programs across the city. On a daily basis, I have the luxury of working at Unity, where I have well-stocked, age-appropriate books to use as a teaching tool during the actual doctor's visit, where I write prescriptions for parents to read to their children every night and to visit their local library. But what about the child who misses her visit with me? As a pediatrician, I may very well be the only professional during the first 3 years of her life. Because of that missed opportunity for me to prescribe her a book, she now lags behind in her likelihood to be a successful reader. A very probable word gap has now been created between one child and another. This is exactly the situation we want to avoid. This is why we need books from birth. By literally sending every child between the ages of 0 to 5 a new book every month, Books from Birth will play an invaluable role in filling this gap between one child and another. This is the kind of legislation that levels the playing field and gives children living in poverty a chance to succeed in school and to maintain their health. Because 80% of DC's children depend on Medicaid for their health care, we know that Books from Birth will have an enormous impact because these are the children who need to be read to the most. This is also the same group of children who will grow up to be adults with a higher risk of suffering from chronic disease and dying prematurely. We also know from a preponderance of data and scientific studies that being able to read increases your chance of being healthy and staying in control of your health. Literacy and health are intimately linked. Every dollar spent on books placed in the hands of a young child translates to healthcare savings. I urge you to swiftly pass Books from Birth into law so we can bridge the word gap and give all DC children an equal opportunity to succeed and be healthy.
Thank you. Dr. Shah?
Hi, good afternoon. My name is Ankoor Shah. I'm a pediatric doctor and board member of the District of Columbia chapter of the American Academy of Pediatrics. So the American Academy of Pediatrics is a 60,000 member organization of pediatricians across the nation. Our DC chapter has over 400 pediatricians, resident physicians, medical students that encompass multiple hospitals, clinics, school-based clinics. Schools are failing our children is a common refrain. It's one I hear all the time. But maybe we are failing to prepare our children for school. In fourth grade in the district, about 50% of fourth graders have a basic reading level. That number shoots up to 70% when we're talking about African American boys. Poor reading in elementary school leads to poor performance in high school, leads to poor graduation rates. If we want successful adults, we should start building successful children as well. So last week, when I was in clinic, I met one of my patients, Thomas, wonderful 8-year-old boy, who's healthy, playful, active. He knows his times tables. His favorite subject is recess. Whose isn't? But he's failing reading, like so many similar patients I have as well. So for Thomas, I've been working with his parents and schools to make sure he gets the services he needs, the extra help he needs to make sure he succeeds. But honestly, it's an uphill battle. And by the end of that visit, like so many others like it, I just found myself wishing, I wish we could have done something to prevent this from even occurring. And because the goal is to improve literacy before they even enter kindergarten. So that's what we at the District of Columbia chapter of the American Academy of Pediatrics believes the Books from Birth program will do. So the question is, does reading to infants and toddlers actually improve literacy? And there are multiple studies that show that when you read to young children, objectively, they improve their literacy later on. There's even newer studies out that are showing reading prenatally actually improves brain function of infants, and when you look at different MRI scans as well. And even aside from literacy, reading aloud helps grow curiosity, motivation, as well as listening skills, all of which are bedrock qualities for all adults. And this reading to children is particularly important when we're talking about poor children. As mentioned before, low-income families, children in low-income families are exposed to 30 million less words than those in high-income families as well. So they're already starting kindergarten with an inherent disadvantage. So these children are unable to optimize the most crucial time for brain development because they just don't have access to the words. So even if reading helps these children improve literacy, how do we know sending books to families will actually help and work? And luckily, as mentioned before, we have a great model in Shelby County, Tennessee. So their Books from Birth program has delivered over 20 million books in 10 years, and they have shown that those that are enrolled in the program have statistically higher reading skills in kindergarten and second grade than those who are not in the program. So the science is clear. We believe that this legislation has the opportunity to create a level playing field for all children entering kindergarten of all socioeconomic backgrounds. And this bill is actually a critical step in the fight to tackle the hard, chronic, underlying factors that affect inequality, the factors that began at childhood. So the science is there, the policy is there. We just need you to be there too. Thank you.
Thank you very much. I appreciate all your testimony.
Dr. Zarr and Dr. Shah bring you into this part of the conversation. How, from the physician's office, from the provider's office, you're already, doing Reach Out and Read, which is phenomenal. From your perspective, as part of this conversation, could you talk a little about where you see your office and your role interacting and intersecting this overall effort? And Mr. Chair, I know I'm out of time on my round. I don't know if we could do a short second round or just kind of extend for a quick second. All right, thank you, Mr. Chair.
I'll go first. Thank you for the question. So if I could just take a brief moment as well, just to sort of hit home once again that I'm a big proponent of universality for a couple of reasons. I already mentioned a few things here about trying to avoid stigma, but there's just simple demographics involved in here. We live in D.C., so 80% of our children are eligible and enrolled in Medicaid, right? So we're not talking about that many kids, actually, who would receive a book in a household who perhaps don't need to receive a book. The vast, vast, vast majority of children who will receive a book need a book. They truly need a book. And I also wanted to make a brief comment, if I may, about the issue of adult literacy or ability to read the book. Well, Reach Out and Read has a long experience with that. I myself personally have a long experience with that. I would say the vast majority of the parents of my patients cannot read the way I read, right? And we know the data is there already, and even my own personal experience, would show that you don't have to be able to read as an adult to read the books he was mentioning earlier, right? So you use the pictures. I mean, if you think about child development, what happens in that first 3 years of life, right? And especially with language acquisition, it's about repetition. It's about learning your colors, your numbers, your shapes, your textures. And those are the things that you find in those hard books that are about this big and the kids bite on and they pass from one hand to another. So we use the tool in Reach Out and Read. We use the book as a tool, to assess development. We use it as a tool to encourage child and adult literacy. So that's how I see the book. The book is one of my greatest tools to prevent future health problems in their life. So I think that we've talked about the partners here, and that's essential. I think that the doctors and the healthcare centers, the folks in DC who are providing healthcare are very, very important partners in this project. But I see it as a huge complement to what we're trying to do. But once again, there still are thousands of visits to get missed for whatever the reason. And this is the way in which you can fill that gap and make sure that every child gets sent that book.
Dr. Shaw, just real fast, I know we're out of time.
Well, Reach Out and Read is amazing, but in my clinic, just this past year, I don't have books to give kids. And I'm a training pediatrician, and I could tell you in training, the last question with every visit for young children is, do you want your book now? And that is something that we have just been ingrained in. So for future pediatricians, for the future healthcare, it is something just so common for us to say and ask for. So it's already ingrained in what we do already. And this bill, and if kind of this works, it'll exponentially get better.
Well, thanks. Thank you for your indulgence, Mr. Chair. I appreciate everybody's testimony. I could go on for hours and hours.